Welcome, everyone, to another episode of Office Hours. I'm Stuart Newsom, your host, and I'm excited to have Bo Bowman with us today. He's our Vice President of Strategic Accounts for Infinix. Bo, how are you doing today?
Hey, doing great. Happy to be here and looking forward to the discussion.
Yeah, I think this is going to be very critical, particularly for cardiology practices. So,
Yeah,
with that in mind, if I just want to give you an opportunity to kind of tell everyone what you do for our clients here at Infinix.
sure. Been in Infinix a couple 2.5 years now, and with a background in health system physician enterprise and really practice management and revenue cycle management on a enterprise scale, and spent a lot of time doing EMR implementations and really trying to sit down with the dyad provider relationship and help the work that the doctors do every day equate to numerical and financial reimbursement that makes it all worth it and significantly improves how they do their job each day. But at Infinix, it's been a ton of fun being able to implement our tools, and so looking forward to some of that discussion today and how we can help those out there listening.
Awesome, awesome. So today we are going to dive into some of those critical aspects of cardiology practice management, how using data can boost reimbursement. That's the whole theme of this particular episode. It should go without saying that data and analytics play an increasingly important role in healthcare industry, especially in revenue cycle management processes. I know that everyone's accustomed to data and analytics. You see it everywhere. The RCM, everyone's been accustomed to that as well for a very long time to understand that you need to
Mhm.
look at this data points. But we're going to dive into kind of the how and the why and what could be possibly missing. Accurate data interpretation can really align your practice with industry standards. And it's also, you want to ensure that there's proper coding, proper billing, ultimately make sure that you have secure and accurate reimbursement. So basically, at the heart of any successful cardiology practice, no pun intended there,
Sure.
but is the ability to effectively manage and interpret data. By leveraging data-driven strategies, practices can identify areas of improvement, streamline their operations, and enhance their financial performances. Everybody knows that if you can't measure it, then you don't know where you are, where you stand. So it's important to have not only these KPIs in place, but you have those strategies in place on how to leverage this information to take effective action to improve your reimbursement and even efficiencies in your operations. So today, Bo and I will discuss how you can use data to transform your reimbursement processes. You're going to be featuring a lot of insights from recent case studies that we've done and some metrics and dashboards that Bo has actually shared with some of our clients as he reviews progress and reimbursement increases with them. So some of the objectives that we're going to cover today, we're going to learn how interpreting data can help align your practice with industry standards, as well as secure your reimbursement. We're going to understand how to read and use RCM metric dashboards to identify areas of improvement and boost your financial performance. And then lastly, we're going to discover how AR optimization tools can streamline your accounts receivable processes, which is going to improve data accuracy as well as provide actionable insights. Now, those aren't exhaustive, so we're going to cover some other factors as well. But I just want to remind everyone that throughout our discussion, we're going to have some real world examples and practical strategies that help prove effectiveness in the cardiology practices. So as always, encourage you to ask questions. We are going to have a session at the very end for Q&A. If you'll just hit the green box at the bottom and enter your questions, Bo or myself will be happy to answer those to the best of our ability. So, Bo, I'm going to get a little started with the first question is, can you share more details about the challenges that cardiology practices face before implementing data-driven strategies?
Sure, sure. Lived through that scenario in most of the late 90s and early 2000s. And really, as practice management systems became more, I'll just say, diverse and had more tools embedded in them, we're always trying to sit with our various groups and say, okay, what are you guys looking at each month? And then, before a group really has a regular cadence of having reports put in front of them, some of the pitfalls I have seen in the past is, talking with doctors, you hear, why am I working so hard, but I don't see any difference in the financial results. And, more importantly, I don't see the impact to my own compensation. And, so those are some of the things that you hear when you're not looking at the data regularly. You get stuck looking at your schedule if you're a provider, and what can I do to make my schedule bigger? What can I do to bring in more patients, hit that X number of diagnostics each month to keep me at my kind of my normal pattern. You also, you spend a lot of time, if you're not just focusing on the say the clean data function. You say, hey, well, I've hired a nurse practitioner, I've hired a PA. Why isn't that working? Well, why am I not seeing more financial results out of that? Are we doing that billing correctly? Again, this is what I've heard from providers that are spending a lot of time working hard and maybe feel like they're spinning their wheels. Other ones were scheduling like a lot of patients each month in the hospital or the lab. But the amount of patients we're actually scheduling to what actually get to the table or the cath lab for the procedures that are scheduled has a significant difference, maybe 25, 30%. Maybe we're scheduling 70 to 80, but we're only doing procedures on 50. So what's going on there? And then, a little bit too of just studying your patient population and having that data in front of you. For instance, maybe I have a really large, patient population, a particular payer, maybe it's a Medicare Advantage plan. And, at the end of the day, when we look at the reimbursement, it's less than what Medicare is paying me. So again, why am I seeing that large patient panel? Those are the types of conversations that I hear regularly or participate in regularly. So, our goal at Infinix is to bring more, like you said, a data-driven approach to it. And let's look at the data each month and its associated trends. And then
Mhm.
let's make some practice operational plans from there.
Right, and just to interject a little bit here, there's also challenges just in regulatory requirements. I mean, you
Mhm.
have value-based care issues with
Yeah.
MIPS, there's challenges. You also have, it just seems like there's an attack on cardiologists for reimbursement and all physicians in that matter. But
There
you're kind
is,
of
and
keep, yeah.
there's also this huge emphasis too on growth,
Mhm.
right? How can I grow? And then, but you want to grow the right way. We see all the time. Well, let's just add two more doctors. We're going to add two more doctors, and we'll be able to have this one at this location and this one at this location. And without reviewing the data first, maybe the geography of it and the payer mix in that area. It turns out you're spinning your wheels and spending overhead where you shouldn't. Remote monitoring continues to just be a remote patient monitoring, RPM, that acronym continues to be a huge industry, growth accelerator for a lot of cardiology practices. But the billing and the data review behind it is quite complex. And if a
Mhm.
practice doesn't understand the whens and the hows, to get their RPM billing done and done accurately, you can trip up on those things. And although you meant to expand and improve your financial outlay and your overall growth, you've actually, kind of put yourself behind the eight ball. So we can dive more into that as we go on here.
Sure, sure, sure. So, well, speaking of that, how do RCM metric dashboards help cardiologists identify areas for improvement?
You know, it's a little bit of a tool that I think every practice should have. At the same time, a scorecard can have a slippery slope if you're not measuring the right things. And so in our talk today, I want to make sure we focus on, what are you measuring and what are you doing with that data. But reviewing a dashboard each month of how the practice is performing compared to last month, last 6 months, last year. That can be helpful. Want to make sure your time periods are accurate. A lot of times what we look at is, okay, so you just finished this last quarter and your results for your whatever it may be, your net collection rate, your denial rate, but where were you same time last year? So looking at time periods and that dashboard is real important. Not only looking at maybe the regular industry standard potential statistics that we'll cover later here for a practice, but looking at that next level of detail down. For instance, looking at your first pass clean claim rate at the clearinghouse level, right? Logging into
Mhm.
the clearinghouse, looking at your rejection rate, looking at total claims submitted that month. and really what came through and what that clean claim rate was. That's very important. The documenting that by doctor, putting that on a scorecard and then sorting it, right? So the providers can see, oh, 96% of my claims go through first time. And maybe you've got a nurse practitioner that's down in the mid 80s. Well, why is that? Let's go study that and put that in front of everybody. Another big one on the scorecard and the importance of it is charge lag, right? We talk a lot about documenting charge lag because that leads to claim generation speed, right? So if your charge lag is 7 or 8 days in the office and 15 days in the hospital, then your claim generation pace is going to be much slower, affecting your AR days, affecting your overall cash to collect. So there's a lot of domino effect that can go on if you don't have a solid dashboard that you're looking at each month.
Yeah, that's critical, and make sure it's updated continuously from that standpoint, and make sure you're looking at the right data at the right time, so to speak.
For sure.
So based on your experience, what are the most significant revenue improvements you've seen from practices that adopt data-driven strategies?
The groups that sit down, I'd say with that dyad or triad, so maybe it's the practice administrator and billing or revenue cycle person, and then either a kind of a lead provider or I've even had, an RN or the lead, clinical technician, but it needs to be a small group, right? 3 or 4 people. You guys are sitting down and looking at either your financial or revenue cycle dashboard each month as where is where your clinical quality is. I know it's hard to find that hour, each month to sit down and look at that, but there is such value that come out of that meeting that will allow you to, see overall improvements. But what we've seen is, your top 3 denials have to be focused on each month. It's typically coding, lack of medical record documentation, and then lack of either the eligibility or not having that prior authorization, right? So
Mhm.
having a data scorecard, a data report that shows me, hey, these were all my denials for the month, the quarter, or the year, and what are we doing about those? Is it provider education? Is it staff education? Those are the types of conversations that can come out of having a good data approach to being able to achieve those improvements. That's really what I'd recommend. And then again, coming up with rules and guidelines out of those meetings. Again, don't just meet to meet, right?
Right.
Meet to put together a set of guidelines and rules that then goes to your board or that then goes to your physician committee, and they all look at each other, vote on it, and say, hey, we're going to stick to this. One that's just obvious out there is, you may have one provider that closes his notes in a day or two, and then you may have one and doesn't close the notes for 7 to 9 days. And here we go again. We're behind in our claims generation because we're not following what we see in the data. So, quick examples on some significant revenue improvements we've seen with our own clients. We've got a Texas group, 12-man group that was doing around 850,000 a month before we started doing their billing and providing some guidance. They're averaging 1.4 million a month now after the first 12 months with us. So, being able to bring it up 200,000 or 300,000 a month, that may sound like a lot, but we really just need to work on making some tweaks. And little things again, like proper prior authorization, proper coding on that claim for first pass clean claim improvement. Those type of things can make a big difference. On average, we've seen, if you're reviewing your data monthly, you can easily improve your overall revenue year over year by 20%.
Wow, that's incredible. I mean, that's significant. That's how you obtain growth.
Mhm.
And that's what the strategy. It's just such an efficient strategy. So what are some best practices for cardiologists to start leveraging their data
You
effectively?
know, Great question. As I was prepping today and really thinking through that, talking to our team, there's really kind of 4, major things that we do every month, for our clients, and we advise them to do the same. We immediately look at the denial report every month, and we've got to see an improvement, not only in your denial rate, which, unfortunately for a lot of complex cardiology practices today can run as high as 15 or 20%. How do I get that down to 5%? What do I do? I'm seeing 180 or 200 denials, a month. How do I get that down to 40 or 50? and that they're in our control. We sort our AR by payer each month. A lot of people just look at your overall AR report and say, where are my percentages for 0 to 30 and my aging? We like to take it down to the next level and really look at it by payer and then age out by payer. We're seeing more and more of the payers not covering various diagnostics in cardiology, not covering, obviously same day consults, or if you need to see an electrophysiologist in or around the same time you've seen your general cardiologist. It's interesting how the payers just continue to, maybe not be as logical as we may think as we're trying to roll out our claim submission. And then just, kind of back to basics, reviewing your high to low patient balance,
Mhm.
charge sheet for the month. How many patients do we have out there that still have a significant balance? For us, that's anything over $500. Do we see improvement on those particular accounts? It's funny, you end up collecting $300 or $400 here and there, over maybe 200 or 300 patients starts to make a significant difference. Same thing at the front desk. We see money just continue not to be collected at the front desk. Maybe don't have good discipline there, or somebody that's really watching that process. And we can sit down with the client and walk through, hey, here's what you're supposed to be collecting today. Here's the target, and then put in a reward for the staff to work on doing those types of things. It's those small things that we see really show up in the reimbursement piece that, if you're watching the data, will uncover itself.
Yeah, that's amazing. Kind of incentivize it and make sure everyone's all in on it. So, and
Absolutely.
works as a team. So, how do cardiology practices typically compare to those industry standards that you were talking about, and those benchmarks as well, when they
Sure.
first start analyzing their data?
Sure. Sure. It's a kid gloves conversation because everybody is working as hard as they can. And again, we spend a lot of time with our clients saying, just because you're spending a lot of time at it, or just because you're putting a lot of work in it, and you're not getting the results you want to see, we get back to that whole work smarter, not harder function. And are
Mhm.
you using the automated tools in your practice management system? Are you using the automated tools that the subscription you're paying to your clearinghouse offers? We sit down with our clients quite a bit and say, hey, you have these 6 or 7 tools in your clearinghouse subscription, and we'd like to set them up for you. And then all of a sudden they're getting emails from the clearinghouse on, again, first pass, clean claim rate, early rejections, and then they get engaged quickly like that. So, but again, before we get there, we've seen a lot of net collection rates down in the high 70%, mid 80s. We'd love to see the net collection rate at that 96, 97%. That is achievable. Sometimes takes more people, or sometimes takes more efficient processes. Days in AR, unfortunately, with, again, the way the payers kind of behave post-COVID, we're seeing it take 45 to 50 days to get paid. Got to get that down below 30. And we see that a lot before we're able to help a practice implement new processes. Again, I talked about that denial rate of 15 to 20% due to coding, due to lack of medical documentation, all the way to the point where you've got to go educate the techs, right? The techs that are doing your PET, your SPEC, your nuke, making sure that the actual invoice for the rubidium for the diagnostic makes it back into the system, right? Because when the biller
Right.
goes to bill, they've got to have that invoice to show the practice incurred that overhead, for all of the necessary resources to make that diagnostic go for that patient. So we see claims, denied all the time because those 7 sets of documentation were not there. Lastly, on the kind of the AR aging, we've talked about quite a bit. Don't want to see that 60 to 90 bucket have a significant percentage, right? We want to
Right.
see that, at 15, 18, 20% at the highest. And, sometimes we'll see it at 30 or 40%. It's dangerous because all of those commercial claims are getting ready to go past filing deadline. So,
Right.
if you don't hear anything today, sort your AR and start working everything from 60 to 90 days, right?
Right. Right.
Sounds
Right.
so sounds so simple, but finding the time to run that report, sit down with the staff, and make sure who knows what to work and how. Those are just such important disciplines to really adhere to.
I know. And then a lot of people don't realize, the consequences because they even bleed into 120 days, which is
Sure.
Nobody
Sure.
wants to talk about that, but there's a large
Yeah.
proportion where you can see the smallest percentage of that, and those just end up being written off,
And
because then you're,
and
yeah.
we hear a lot, don't worry about it. We're just going to go get the retro authorization on that. Good luck. Good luck. We don't see a lot of retro authorizations happening with Blue Cross Blue Shield these days. We have seen United Healthcare and Aetna be a little bit more accepting, as long as, again, you had the right medical record documentation in
Mhm.
place and you could show medical necessity. And so, I mean, we have auditors and quality auditors here at Infinix that do just that all day, going
Mhm.
back and helping the clients find all the necessary medical necessity documentation, and making sure that, when it is resubmitted, we can get through, that piece of it.
Right, and that's always the common denominator. It doesn't matter what subject we're talking about. We, here at Office Hours and in our podcast, we always circle back to where we just mentioned those two things: documentation and
Hmm.
medical necessity.
Hmm.
It really, those are the common denominators for everything, whether it's prior auth, whether it's sending in claims, the coding that goes on there. It all matters. So that's kind of always a reminder, that if you can just get that right. I mean, there's a lot of things also have to do right, but if you can get that right, you can stay ahead of the game.
Yeah.
Um, so just shifting to some of the technology
Yeah.
forefront here, what future trends do you foresee in the use of data and technology to improve cardiology reimbursement processes?
Yeah. Obviously, a big discussion at Infinix, right? We're trying to be out on the leading edge. We're trying to help clients understand when it's appropriate to use AI, how to use some of the automation processes that are out there. You've seen Navaneeth Nair, our Chief Product Officer, talk quite a bit on LinkedIn and on Office Hours about, installation of some version of an automated or AR process doesn't necessarily mean everything's just going to be fixed overnight. So we like to have thoughtful conversations about which technologies to use and when. I mentioned remote patient monitoring earlier. That's a process that can be easily automated. Office claims generation and then submittal to clearinghouse can all be automated. Again, knowing how to use the tools inside of your EMR, and having those pieces. But I made a couple of notes here. There's tools out there for coding and claim prep that we can help a client set up. There's first pass claim scrubbers. Either you can use the ones inside of your EMR. We have a tool that we can install, and your clearinghouse has tools that they can install. But that automatic claim scrubber is so important, because you hate to see claims go sit in a work queue that just need a quick small, maybe we just kind of fat fingered a subscriber number, or
Right.
maybe just, it was a six code claim. We left off the sixth code for whatever reason. And again, it goes out there and sits for 30 days. But having automation to identify, hey, you needed these six codes on the claim and we only see five, being able to remedy, repair, and resubmit, my favorite three R's, and do that all in a business day goes a real long way in regards to your overall reimbursement that you see each month. There's a lot of predictive software that can be embedded in the EMRs today. A lot of folks don't have those turned on, and so we can sit with the client, help them figure out, should you turn that on, and if you do, here's what it will here's where your benefit will be, and then also here's what you're going to have to work and look for. A big one too, I hate to go back to it, but it's medical necessity, and then how that ultimately leads to getting the prior authorization. And Infinix has great prior authorization tools where we can use our IPA tool to help you automate and hit those portals, on an automated basis, and what can't be fixed. Then we've got teams to help you fix that, or we can help train, your internal teams. And, just using some of those pieces again, and not being afraid to learn how to access the technology, and maybe started on another thing that we see all the time. Well, I don't want to roll this out to the whole practice, right? That's
Mhm.
okay. We do lots of pilot studies where, we'll take the top two or three highest performing doctors in the form of, volume and overall claims submission, and we'll roll out automated, claim scrubber first pass review on those first two or three. and let's see how that goes. And if that goes well and we see a lift there, then let's work on installing it throughout the whole practice, right? So just
Right.
taking small bites out of the apple when it comes to properly using the technology that's out there today, I found to be a much better pathway than making overnight grand scale changes.
Yeah, taking just little small bites, how do you eat an elephant? Take the first bite, one bite
Yeah,
at a time. So it's
yeah,
definitely, productive, to adopt AI. I like to call it augmenting intelligence rather
yeah.
than artificial intelligence because it's really there to help everyone work better and perform better. Those mundane tasks that, can be corrected really easily, that some examples you gave, and then reserve the more complex cases for
Mhm.
staff to work on. And it just increases efficiency, not only from the reimbursement standpoint in your AR, but also the work and time you're getting out of your employees from the FTE standpoint. So
Mhm.
there's a lot of ways to cut the savings when you look at that, from that
There
standpoint.
is an implementation so important, right? There's two or three big practice management systems out there that we work with that we use real regularly. And again, if not implementing some of their AI or some of their automated tools the right way, can actually cause more work and
Yes.
slow claims processing down, right? You can increase those practice management queues where either the practice manager, administrator, or revenue cycle person has to go back and review all of those claims, resubmit them depending on what's going on, because either we had the claim scrubber or whatever the automated tool is, if you will, turned up too high. And
Mm.
so again, having a pilot and working through the pilot is very important, and Infinix can come alongside of you and help you with all of those pieces.
Awesome. Awesome. Well, we're about out of time.
Sure,
I want to thank you both for your insights,
you bet.
but also want to turn to our Q&A.
Sure.
Just kind of see if there's any questions that need to be addressed right now. So now's the time. If you haven't put in a question, go ahead and put one in. But we'll dive right in to the first question here, and it really has to do with regulations. As I mentioned a little bit earlier, there's a lot of regulatory requirements that are being inundated on providers with constant changes in healthcare regulations and payer requirements. How can cardiology practices stay ahead and ensure their data and processes remain compliant and efficient?
A few thoughts there. Each year we sit down with each client and we go through what any fee schedule changes have come out from CMS. So that's a good place to start. Every year we review if there's going to be any CPT codes change, if there's going to be any change to consult codes, and then we go into that client's EMR and review the fee schedule. So that's a big one every year because that helps you stay compliant. Doctors are famous for using dummy codes or codes that they feel I'm doing this work. There's not a code for it yet.
Mhm.
Those can be dicey waters. And so we try and work closely with the client to ensure that, what's in their system is the most accurate it can be. So when claims generation goes out, it gets fixed. Another big piece of it is one-on-one education. Big believer in bringing in a quality auditor. We've seen obviously recovery audit contractors get real popular these days. Most of our clients have received some sort of RAC audit notice, depending on what the trend is, whether it's an electrophysiology procedure or a procedure in the cath lab. And so, what we've seen with a lot of the audits too is the providers end up scoring out well, 99%,
Mhm.
98%. But there's so much focus on, is there any overuse? Is there any underuse? And so what we again do is focus real heavily on, do you have your medical necessity and your medical record documentation loaded appropriately? And
Right.
we have whole teams at Infinix that do just that, and then help you get that loaded and again resubmitted and get you back off to the races. But following the LCDs, making sure you're using tools like Encoder Pro. Infinix also has a tool that we use to make sure we're, the provider staying within 98, 99% of the Medicare norms. Those are real important again, I can't stress enough, doing quality audits, picking 10 random charts from each provider and going through those by payer, trying to do that 2 or 3 times a year. Those are the ways that we've seen our clients stay in front of any audit or regulatory that may be coming down.
Yeah, awesome, awesome. Okay, well, I don't see any other questions in the queue. And with that, we can conclude this episode. Bo, as always, really appreciate your insight. It's always just a wealth of knowledge that we share with everyone, and hopefully everyone can have some gain from that. So I'd encourage you to rewatch this video and look for some other additional content that we're going to grab out of this that'll be coming very soon. So stay tuned for that. And also join us for next week's office hours. So looking forward to seeing you there. And everyone have a great day. Thank you.
Thank you.